Welcome back to Living Local, everyone. We're at the Colorado Springs Orthopedic Group talking to Dr. Watson, who is our hand, elbow, and nerve specialist, and we're going to be talking about nerve damage this morning. So what does that mean? Like, what is nerve damage?
So nerves are the wiring, if you want to think of it that way, that carry messages away from your brain to the extremities in your body, okay? And so that means that they carry information from the outside environment back to your brain, meaning things that you touch and feel, knowing if they're hot, cold, how hard you're pressing on something. And they also carry information outward from your brain to your muscles to move your limbs, to help you walk, sit upright. They control the muscles. So what nerves are extensions of your nervous system, and they are very sensitive to pressure. Right? They don't like pressure from the outside. And it's one thing to put a little pressure on your skin or your bone, all right, it's going to withstand it, but nerves don't like that very much, and that's usually when we start having problems with nerve pain, if you will. Usually it's from nerve compression where the local blood flow diminishes around the nerve, and that can be, you hear people having pinched nerves in their neck, and that's just a little pressure, say from the disc or one of the adjacent bones in your vertebrae that are pushing on a nerve. And I'll often see people, of course, in my area for pinched nerve in their arm, like carpal tunnel syndrome is just a little pressure on a nerve as it goes through your wrist. And when nerves get pressure on them, the local blood flow diminishes, and that makes them act up downstream. It makes them feel bad, meaning you may feel numbness, tingling, burning, downstream if it's your carpal tunnel, or if it's up here at your neck per se, you'll feel it downstream going down your arm or maybe around your back towards your shoulder. So you can feel it can give you a distorted sensation like that. It can be painful.
Okay, so that nerve damage then feels painful. Is
Yes.
it permanent?
So it depends on how long it's been going on. So a little bit of pressure on the nerve can make it act up, but it's largely reversible, meaning when we take pressure off nerves, either through therapy or medication, sometimes a little steroid injection, you'll hear people getting injections in their neck or in their carpal tunnel, that gets the inflammation down, gets the pressure off the nerve, and in other words, it's readily reversible. But over time, if a nerve has enough pressure on it for a long enough period of time, it can undergo, if you want to think of it as scarring on the inside, irreversible changes. So we don't like to wait so long that happens.
Okay. Are you able to still function then, like a hand with carpal tunnel, with that permanent nerve damage?
It depends. Well, you can function, but you'll start having perhaps permanent changes in your sensation where it's hard to do fine manipulation, things like buttons or earrings or contact lenses. So if you have long-term nerve damage, those things are, even if we take the pressure off the nerve, it may not come back all the way. And sometimes people will even have changes. Remember I said it carries messages from the brain to your muscles. You'll have muscles that just stop working over time, but that's not going to happen in a week or two. That's a much longer time period. Yeah.
Okay, that's years of pain
years or
and
months,
tingling.
yeah.
Okay, so if you feel that pain or tingling, is that when you should come see a doctor?
Yeah, I mean if you just shift in your chair and it goes away, you're fine. All right, but if this persists, if you're waking up in the middle of the night over and over with your hands numb, tingling, that's often what happens with carpal tunnel syndrome, or with positions in how you sit while you're driving. It can be something from your neck. If you notice these things, yeah, it should be evaluated.
Okay, and they can always come to you here at the Colorado Springs Orthopedic Group, to you
Sure.
or one of your coworkers, and get some help. And how can they get in contact with you?
You can certainly call 719-632-7669 is our main office number, and they can direct you to either myself or one of my colleagues that also works with nerve problems, or spine surgeons as well. And then also online at csog.net.
Well, Dr. Watson, thank you so much for your time this morning.
Sure, thank you.